We can't still. Is there any technical support that you can get around you, or can you try to join again, since Moldova is going to present and we really want to hear them, all of us very excited.
Hello.
No. Hello.
Hi.
I think we heard you saying hi, but not sure if it was you, Jayatma. Can you try again?
Hi. It was me.
Yeah. Oh, it's Esma. So we couldn't hear you.
You could not?
No, we can hear you, Esma.
Okay.
We try to understand if we can hear Jayatma.
Oh, sorry.
That's fine.
Um,
Okay. Because Jayatma said that she will try to leave the meeting and join again because she can't either hear us either. So we are waiting for a few more seconds, minutes to make all these technical arrangements.
mhm.
Okay, hello everyone again. It's very nice to be here. We are already 10 minutes late, but let's start. We are waiting for Jayatma to join us as well.
Hi,
We know
do
that
you
there...
hear me now?
Yeah, now we
Great.
can hear you and see you.
All right.
Great.
Thank you. I'm really sorry. There were some technical difficulties, but very glad to be here.
Yeah, we are glad to see you too. Let me introduce myself first before we start the whole 2 hours youth-led regional consultation starts. My name is Dağlar. I am based in UNFPA Eastern Europe Central Asia Regional Office as a youth partner, and I am international coordinator in charge of monitoring and evaluation of YPR. I have been communicating with young people around the region for, I don't know, for 5 months, I guess now. And we have been working nationally and regionally all together. So it's super nice to see everyone here online, but I feel like it's almost face to face. So I'm super excited. And we know that young people are one of the key actors of to achieve the goals of Cairo. And even though we were too young to be there in Cairo, we are embracing all the goals decided there, and now we are trying to make all the goals real today. We know that there are both improvements and backlashes until then. And we know that each country has different experiences and ways and different solutions and different ways of advocacy. So this consultation aims to gather all the information, all the experiences coming from Eastern Europe, Central Asia region. And we will try to look at ICPD 25 through a regional youth lenses. Today, in the first part, the consultation will have 3 parts. In the first part, we will have 9 countries presenting the national consultations they already organize in their countries. So they will only have 3 minutes per country. So it's very short, I know, but we are super excited to hear creative presentations to make it short. They will mention 3 main things. The first thing is their experience when they're organizing the consultation. Secondly, they will express the solutions they come up with to the challenges we always talk about. Now we are going to focus on more solutions than challenges. And thirdly, they're going to talk about commitments of youth. So where does youth stand for these solutions proposed? We have Julia in Petri, and thanks to her, we will be able to provide English summary for the Russian presentations, if there is any. If there is any Russian speakers wants to present in Russian, please let us know in the chat box. So we are going to arrange this with Julia. In the second part, we know that not all the countries could organize a national consultation. In the second part, we will give space to the countries who couldn't organize a national consultation, but of course they have important contributions to make and to say. So there will be 2 minutes presentations per country, and there will be 1 person, or I don't know, 1 presentation per country. It will take 2 minutes. And we will hear all the countries in the call right now. And so far we were calculating, and we think that there are 16 countries online. So we hope to have 16 presentations. Then we have 2 important guests. They accepted our invitation. So we are very glad to have UN Youth Envoy Jayatma and UNFPA ICA Regional Director Alana here on the call. We are excited to hear their reflections when the presentations are over. We are looking forward to hear their opinions about the presentations, about the work, and also about their commitments to youth. And in the last part, we will open the floor for the discussion part. There can be questions to any of the presentations, or Alana or Jayatma, or it can be only contribution or comment about the region and youth involvement and ICPD 25. I am looking forward to having this conversation all together. Before we start with the presentations, I want to give floor to Sargis to explain about technicalities of the Zoom and this online world. Thank you.
Hi, everyone. Thank you, Dalar, and thank you, everyone, for joining. I'm also, just to say that we have two devices connected. This, the one and Petri is the same, not to have any confusion. I'm Sargis, and I'm joining from Petri, and I am one of the international coordinators of YPR International Youth Network, in charge of advocacy and partnership. And as Dalar mentioned, we have been working for Nairobi and for the youth consultations nationally, locally, and internationally for a long time. And I'm really excited as well to see all on this board and to hear all the experiences that you have had throughout the processes of national consultations. Just to give a little bit of technical introduction to make sure that we all are on the same page of what we are going to do. I want to say that just once again, if you're not speaking at the time or at the time of any presentation, we would recommend to mute yourself, because we are many, and it could from UNFPA who will be looking through the chat box. And as Dalar mentioned, we will be having the chat box as an opportunity for urgent matters and also for questions. So you can easily use the chat box and get to us through the chat box. Each country will have 3 minutes of presentation. And we would like to keep that 3 minutes in shape so that we can finish on time as well. We have one tool. I will share a link and a code. I'm sure most of you have heard of the Mentimeter and word cloud. So after each of the presentations, we're going to ask you to write a word in the website that you will open. So we will share with you a website, the link of the website, and also a code that you would put to enter the website. And then you will see a table of 10 words, and we will have around 10 presentations. So that means for each presentation, you will have 25 characters to summarize the presentation that was just delivered. So we will furthermore explain this, and I will quickly also share the link and the code. And if you have questions related to this, you can get back to us during the presentations. The sequence of the presentations will be announced by me and Dalar, as we are co-hosting the consultation. And as I mentioned, all the comments should be written in the chat box. And as also Dalar mentioned, we will have 2 minutes per country that haven't done the consultations, national consultations yet, but would like to express their in general experience in terms of young people's solutions and ways that they see towards the roadmap of Nairobi. I think that's it. And once more, we have Julia from Petri team, as Dalar also mentioned. We will be having opportunity as well for Russian speakers to freely speak Russian. And then whenever you're speaking Russian, just would be really helpful if you could speak slowly so that Julie could summarize in a way to debrief after the presentation. I think that's it from the technical side for now. And I would be really glad right now to pass the floor to my colleague Anu Kim, who has prepared an amazing presentation for the young people in our region in terms of numbers. I hope Anuki can hear me. And
yeah. Can you hear me?
Yes.
Yeah.
Perfect. So yeah, as Sargis mentioned, we have the presentation. Dalar, if you are able to open it.
Yes, I'll be doing that in a minute.
Okay, meanwhile, I would like to introduce myself maybe. I'm Anuki Mosiashvili from Georgia, and I'm one of the international coordinators of YPeer Network in charge of capacity building. And I'm very excited to join this regional consultation today and also to hear the results of national consultations from our region. But as Sargis mentioned, we also prepared a brief presentation about region in numbers. So to show you some of the key issues and some of the key numbers in our region in Eastern Europe and Central Asia, it's going to be very brief, like 5 minutes presentation, because I'm sure the country presentations will feed into all these statistics and data later. And to start with, but promise I'm not going. Oops. Can you hear me? Yeah, right?
Yeah.
Okay. Yeah. So to start with, about the numbers in the region, young people represent around 22% of the population, of the entire population in the region. But it's actually higher in the Central Asian countries. It rises up to 30%. But this percentage reflects the age group from 14 to 25, but the population of youth adults, like we call it, youth habitats, is even larger from the age group of 15 up to 30. That means that young people represent quite a big portion of population in our region, and some of the key issues of concern that are reflected in some of the documents prepared by the UNFPA regional office. Among these issues, one of the most important was always mentioned, youth unemployment. And youth unemployment is challenged by young people, and it's like 20% in the region. And also the young people who are not in employment, education, or training, like we call it, needs. This figure averages 90% across the region. This is quite high number. And other key issues are also related to, of course, inadequate access to comprehensive sexuality education. And I think many of the countries can relate to this problem, like in Georgia, but also some other countries. And we know that in some of the countries, there are also strategies and policies, but usually it lacks the proper implementation process. So this is one of the challenges. Also, gender inequalities and gender-based violence, inadequate access to sexual and reproductive health and rights, and the services that meet their needs of young people. And also, it is very common in our region that sometimes like migration, because of economical migration and parental labor mobility, can impact on the stability and income of the families, and that of course affects young people in the region. Some of the data and statistics related to family planning, the use of modern contraceptive among young people is quite low in the region. In Eastern Europe, but excluding Russia and Turkey, 22% of girls in the age group of 15-19 years old, they use modern contraception, but in, for example, Central Asia, the percentage is 13%, and in the Caucasus, it's 3.6%. Abortion rates among young people in the region below 20 years of age are significantly higher than in other European Union countries, with the highest rates in Moldova, Belarus, Georgia, Serbia, and Ukraine. Besides that, the problems are also related to HIV. Young people from the key populations and young people living with HIV experience all the vulnerabilities that can be social exclusion, potential alienation from friends and families, gender-based violence, homelessness, even stigma and discrimination. And in our region, Eastern Europe and Central Asia, it's the only region where HIV infections continues to rise up to concerning rate. Between 2001 and 2011, HIV prevalence doubled among young people in Eastern Europe and Central Asia region, and also data on knowledge of HIV prevention among young people is quite limited. This is also one of the challenges. In our region, harmful practices is also something that we as young people face a lot. And among harmful practices, we mean high rates of early marriages, also gender-biased sex selection in some of the countries, and there are alarming indications of the increase of female genital mutilation in certain communities and in certain countries. But to sum up my presentation, which was, as I promised, very short, of course, it's very important to make data-driven decisions, but we should not forget that behind each number, there are real lives, there are real needs, and we should also hear the stories that are not told yet. Thank you so much. I will pass the floor again to Dalar. Thank you so much.
Thank you very much, Anuki. We are sending you applause for that nice presentation. I think Sargis will move with the country's presentation. So we are excited to go to the part with countries presenting.
Thank you very much, Anuki and Dalar. Yes, the time came for the country presentations. So we're going to move the sequence will be through the geographical aspect. We took that idea to go ahead with it. So we will move from the east to the west and taking accordingly. So in our first list, we have Kyrgyzstan. And before starting, I want to say that the national consultations happened before the regional virtual consultations that is happening right now. And all the countries that are present here have done national youth consultations in their countries with the help of the UNFPA country offices or other stakeholders, youth organizations. And right now, it is a great opportunity to hear of the results of these national consultations, focusing on the solutions and the way that we see that these problems that we face could be tackled when we go forward. There are countries that haven't managed to do the national consultations, and they may and probably will do the consultations after the regional consultation. So this is also a good opportunity for people that haven't done the consultations yet and are taking this opportunity to hear from other countries to be ready to do the national consultations. I would like already to start and to give the floor to the presenter from Kyrgyzstan. If the person is here, do we have the representative from Kyrgyzstan?
Hello everyone, my name is Volk Batırgaliyev and here
my name is Belet Kolbekov.
We represent different organizations. I represent Reproductive Health Alliance of Kyrgyzstan, also the Youth Focal Point of Family Planning 2020 and YSAFE member.
And I'm representing LGBT organization Kyrgyz Indico. We are working with lesbian, gay, bisexual, and transgender people.
So we don't have yet our national consultation. We have consultation after this virtual conference, but we prepare some background information and situation what we have in Kyrgyzstan related to youth and SRHR sphere and also the ICPD goals and values. So Kyrgyz Republic's population is estimated at 6,389,500 in 2018. Of those, 34% are under the age of 15, and 6.2% are over 65. This means that we have more young population in Kyrgyzstan, and the country is rural. Only about 1/3 of the population live in urban areas. In Kyrgyzstan, young people aged 14 to 28 make up 27% of the total population. We are in the 3rd place in our region in terms of teenage pregnancy, 42 per 100 teenagers. The state guarantees program guarantees free health services package for the women and children under 5 years general, and stable decrease in perinatal and neonatal mortality due to targeted and effective measures at different levels. Nevertheless, the country has the highest maternal mortality in our region. It's Kyrgyzstan in the 2nd place in Central Asia countries in terms of maternal mortality. In 2018, for example, it was 28 and 0.6 per 100,000 born alive. In 2018, the government of Kyrgyz Republic joined the Family Planning 2020 movement, making Kyrgyzstan one of the 46 total countries out of 69 countries that have now made commitments to Family Planning 2020. So there is a strong engagement of civil and professional society, and the centralization of the policy decision-making makers has been instrumental in focusing the spotlight on SRHR issues. So Kyrgyzstan's young people also have trouble getting information about reproductive health and getting professional user-friendly medical treatment for related conditions, including sexually transmitted diseases and infections. Adolescents' pregnancies shows that adolescents' fertility rates in Kyrgyzstan are in 3rd place, in 3rd highest in our region, at 32%, 42 per 1,000 live births per 1,000 women under 20 years. The rates have increased by 1/4 between 2000 and 2018. So unsafe abortion is more common where adolescents and youth have unmet need for contraception, where less effective contraceptive methods prevail, and in settings where abortion is criminalized. And last year, 2 girls of 5 women died due to abortion. So what kind of challenges also we have in Kyrgyzstan is socio-economic and geographical inequality, adolescents' health, improving the quality of health services, providing comprehensive sexual and family planning health services, and also the high level of maternal mortality. There is some facultative hours of health lifestyle, but no mandatory age every year, so we don't have comprehensive sexual education as what was said before previous in presentation. So also the low level of youth participation in decision-making processes, stigma and discrimination towards key population, limited number of friendly health providers, bride kidnapping, it's the highest level and one of the big problem in our society for today. So also lack of awareness about human rights, SRHR and HIV, centralized health services, and also about family planning, it's Kyrgyzstan's overall CPR contraceptive prevalence rate has declined substantially during the last 3 years due to absence of supplies of contraceptive from international organizations. The level of use of contraception among VRA declined from 32 in 2015 to 25 in 2018. Significant challenges stand in the way of making contraception more widely available and accessible as for vulnerable VRA, higher contraceptive prices, knowledge barriers, and clash between cultural and religious values, which is especially apart with respect to sexual and reproductive rights. So, Sergey, sorry, do we have more time or? I think it's all.
Thank you very much. Thank you very much, Ulu, for the presentation. No, I think we are over with 3 minutes. But do you have anything important else to add to your presentation?
We have like steps, but I think it's not. Yeah, we can also share after this.
Thank you very much for your presentation. So you are going also to do your national consultation afterwards.
Yes.
Okay, thank you very much. Just a little one note. I have shared the link through the chat box. You easily go to menti.com and use the code 40225, and you will be having the opportunity to have 10 columns, and for each column you just put one word. Let's say Uluk just did the presentation for Kyrgyzstan, and to summarize in 25 characters, in your opinion, it would be really nice for us to have a summarizing wording in each for each presenter, so that we can have a word cloud afterwards. And then we will have notice, 30 seconds notice for each presenter when the 3 minutes are approaching. Thank you. I would like to give the floor to Dalar to represent the next presenter.
Thank you very much, Sargis and Uluk and Kyrgyzstan team. So we are moving to a bit west to Caucasus, and we are moving to Armenia. Is there anyone from Armenia right now?
Yes, can you hear us?
Yay, great, we can hear you.
Okay, so we got 3 minutes, right? Okay. So hi everybody, YP Armenia here. I'm Ilon at the FPC of the network, and this is Garik, one of the FPs. And so we will start from, we just want to say that first of all, youth is 23% of the whole population of the country. And on October 10, we did our national consultation for the Nairobi summit, and we tried to include as many, it should to be as inclusive as possible. So we had more than 10 NGO representatives from all the regions of Armenia, and people from vulnerable groups as well. And with the support of the UNFPA, we had everything, all the humanities, and we did our national consultation. And during the consultation, we had different groups of people who are working in different spheres to, of course, related to the ICPD agenda, to come up with prioritize the main problems and to give the solutions for them. So the first one that we worked on is the lack of comprehensive knowledge on STIs, particularly HIV/AIDS, because in Armenia, it's only less than 15% of young people who have the comprehensive knowledge of AIDS. And this is a very huge problem for the country. So one of the solutions we propose is to improve the formal and non-formal education, to reject the misconceptions about transmission, as well as prevent the chances of getting infected in the future.
So the other problem we have here in Armenia is discrimination and violence against vulnerable groups such as LGBT community, women, and disabled people, and so on. And here are the solutions that we suggest. First is adopting comprehensive anti-discrimination legislation. And the second solution is to provide equal treatment from law enforcement bodies towards all groups. And last but not least, we suggest to ensure the implementation of existing laws.
Okay, and the third, one of the most vital problems is that the lack of infrastructure and access to information for people with disabilities, especially people with visual impairment and those who are using wheelchairs, because here we don't have the facilities, and the solution is to improve the facilities to full physical accessibility, as well as create audiobooks for those people who are visually impaired, and also have the strict implementation of the existing legislation. As we are very short on time, we are not able to cover all the problems that we had discussed and the solutions we wanted to provide. So we only want that our national commitment can be worked from the government and can be solved, can solve the existing problems that we see as youth. Thank you very much.
Thank you.
Thank you very much. Thank you very much, Armenia. So just a quick reminder coming from Petri. So when there is this Mentimeter website, you see 10 words to enter. Please only enter one word per country. So the first column is for Kyrgyzstan, and now the second column is for Armenia. Try to find a word which summarizes what they shared with us. And then when you complete all 10 words here, then we are going to submit all together. So please don't submit when you enter one word only. Thank you. I think everyone put their words to the Mentimeter. So who is next, Sargis?
Okay. Thank you, Ilon and Dalar. We're going more west, and we're reaching Eastern Europe. And the first country from Eastern Europe that we have that will present the results is Moldova. Do we have the representative from Moldova? I remember we had technical problems.
Can you hear me now?
Yes, we can hear you. Do you hear us?
Yes, I hear you. I'm happy. Hello, my name is Ana Maria, and I am also a member of YPIR Moldova, and I will present our country. Young leaders from Moldova make commitments to accelerate the promise of ICPD. In the Republic of Moldova, under the NFPA leadership, there have been organized 2 national consultations to review the Moldova's progress on the ICPD program of action in the last 25 years. They set up national commitments and action to accelerate the progress. On the 30th of July 2019, 30 young leaders, members of the local youth councils, youth centers, and YPIR network from the Republic of Moldova participated in a consultation session. As a result, we, young people of Moldova, commit to finishing the ICPD agenda by being actively engaged in advocacy and promotion of the rights of young people through peer-to-peer education on sexual and reproductive health, active participation in civil society, youth, and grassroots networks. Secondly, acting collectively and encouraging others to provide equal access to education, health, employment, and social services for all young people, especially those who are left behind in a society that all of us have equal opportunities in Moldova. Informing and raising awareness in communities about tolerance and non-discrimination towards people living with HIV, ethnic minorities, people with disabilities, and young people. Using innovations in educating young people, especially those from vulnerable groups, to avoid risky behaviors, teenage pregnancy, and HIV. Being vocal about the sexual and reproductive rights of young people at local, national, and global forums. Collaborating with the local authorities to ensure that youth centers have friendly and accessible spaces for the development of all young people in Moldova. In the same time, last week, on the 8th of October, in the Parliament of the Republic of Moldova, was organized national consultation on the progress in achieving the ICPD commitments. I, together with other young people and more than 70 decision makers, civil society organizations, attended these consultations. The development of young people and well-being was largely discussed. The national commitments will be presented by the Republic of Moldova at the Nairobi Summit in November 2019. Thank you for attention. That's it.
Thank you very much. It was amazing to hear of all you have done. I would like to remind everyone to put the word, if you are possibly on the website of menti.com on the 3rd column, because we are already we had the presentation from the 3rd presenter. And I'm passing the floor to Dalar to introduce the next presenter.
So we are going closer to the sun. and we are going back to Central Asia. And the next presenter is Kazakhstan. Is there anyone from Kazakhstan?
Yes, hi. Hello?
Yes.
Can you hear us?
Great, we
Hi,
can
my
hear
name-
you.
Cool. So I'll try to be as short as possible. So good to see all of your beautiful faces here. I will just briefly go through on how our consultation went. We included 5 regions because Kazakhstan is a large country, and we really needed the input from everybody that we could reach out to. So we held it online with the list of questions. We spoke about SRHR education, where most of the people pointed out that SRHR education shouldn't only be focused on young people, but also on adults, because often their ideas, or when they go with their trainings and start speaking to older people who make decisions, get crushed because of their views and the stereotypes and things like that. So one of the suggestions right away was in SRHR education to include not just young people, but also create an environment where young people can interact with the adults that make decisions to change their opinions towards having more education. And then they also spoke about how educational organizations should be incentivized to push for a SRHR education agenda, because often these processes stop at local decision-making level, meaning that some of the decision makers may be more open and lenient towards having SRHR education in schools, but then when it goes down to schools themselves locally, then at the level of the headmasters or teachers, it gets canceled. So then we need to work in that area as well. Access to healthcare services was another issue that was mentioned. Some of you may know that the informed age of consent in Kazakhstan is 18 years at this point, and we've been advocating for lowering the age of consent for healthcare services. Last year, we held a large campaign where we spoke about the need to stop basically limiting the access to healthcare services. And right now, the law is undergoing a revision, and basically at this point, it says that all healthcare services will be allowed starting at 16, except for abortions, which is not what we intended initially, but still we're very happy that other services will be available for young people to make decisions independently starting at the age of 16. And this really showed us that coming together and holding advocacy campaigns together with and other partners and joining our effort with other NGOs also can result in larger changes. We also spoke about gender imbalance, both at the decision-making levels and the gender inequality in the society. Bride-napping or kidnapping women to make them forcefully marry them is still a widespread tradition in Kazakhstan, especially in the southern regions, where gender equality is not a topic that's usually discussed. That was one of the key focuses, speaking to the young people from southern regions. It's one of their biggest concerns, and also they feel that this is one of the biggest promises that was unfulfilled after the ICPT declaration was signed by Kazakhstan. People feel like there was nothing, not a lot done. So yeah, I'm sorry I went over time a little bit, but the commitment is that we will continue working together with partner NGOs, both locally and internationally, and especially with the UNFPA country office that keeps supporting us. And we thank all of you guys for your support and the support of our local partners in Kazakhstan, and we're committed to continue working together. Thanks.
Thank you very much, Camila. Yeah. half silent, half loud applause, applause. So I want to remind to put one word for Kazakhstan and their great work. So I wonder who will be the next.
Thank you, Camila and Dalar. We're moving on to the mid region of our region, and we reached to Turkey, and we have a presenter, Berat, or who is presenting from? Do we have the presenter of Turkey? Great.
Yeah, he's next to me. Yeah, wait.
Hello, everyone. Okay, I'm waiting to our presentation. Yeah. Come on. Okay, there are some technical issues. Yeah. Hello, everyone. My name is Berat from My Peer Turkey. Actually, I want to first start with our youth consultation meeting. It's a brief info about it. We can continue, by the way. We was held this youth consultation meeting at 19 September in Istanbul, and there were 8 youth organizations. From this organization, there were also 14 representatives. It was really fruitful meetings actually for us. And I want to continue with our creative solutions because, as you know, every country has similar problems actually. So we have also some kind of problems. And first one is take care of yourself, HIV and AIDS informative box game. It is very useful because, you know, young people cannot reach every time and everywhere. So it's portable and it has got lots of information about HIV and AIDS. So it's very useful and creative, we think. Second solution is virtual peer website. Again, some of young people cannot reach through information about sexual health and reproductive health. So we create a virtual peer website, and people from rural area, they can also reach information. And the third one is theater based on training performance. We are using theater to share information actually. So it's about also HIV and AIDS because in Turkey it's really high numbers actually who are living with HIV. So we are using theater, and there is also a video. Dollar. Yeah.
What happened?
Just a minute. Thank you. It's very effective also, and we can reach many people just one performance, for example. Just a minute, yeah. Also, we have fourth creative solution from other NGOs from Turkey, youth NGOs. It was social media campaigns. We have active promotion of the SDGs, like gender equality, through social media. It is also a useful tool, actually. And I want to share some commitments from our youth consultation meeting. Firstly, sexual and reproductive health, we commit to carry out advocacy activities to include CSE in the curriculum. It is also a big problem for Turkey. Take concrete steps to make informative materials more accessible to people with disabilities. Advocate for increasing the number of anonymous testing and consulting centers, and advocate for the establishment and expansion of youth-friendly health services. Youth participation, we commit to do advocacy trainings for young people to take part in decision-making process, empower young people where they might be exposed to age discrimination, and strengthening young refugees in terms of education, health, and participation. And the last one, gender equality, we commit to use a language to promote gender equality in our own social media accounts, and follow up the convention and laws like Istanbul Convention or CEDAW Convention, supporting gender equality and advocating for the implementation of this convention and laws. I'm sorry, I am a little bit late, but thank you.
Thank you. Thank you, Berat. It was an amazing presentation and motivational in a way, all the interesting and unique techniques that you have used for your national consultation. Thank you very much. So we have the next presenter who will be announced by Dalar.
Don't forget to put this one word to Mentimeter. And we are going back to our lovely Balkans, and we're moving to North Macedonia. I can see the team here.
Hello, everyone. Hello from Skopje, country office of UNFPA. I'm Lina, focal point in charge from Viper Macedonia. Together with me are Teodora and Christian from Viper Macedonia, and Maria from UNFPA, country office Macedonia. So now I will ask Dalar if she can please put the presentation so I can tell you briefly about the youth consultations in Macedonia.
It's super complicated for me, but I'm handling it. Sorry for the... Yes.
Okay, firstly, I would like to say that the process of national youth consultation in Macedonia is still ongoing. So till now we have online public surveys spread through social media. We provided an infographic for better understanding on ICPD and Agenda 2030. And we had some of the online consultation with NGOs that work with youth. And also national youth consultation event will be on November 2019. So 20 representatives from 20 organizations will be present on the National Youth Consultation event in November. So till now we have some of the key issues that we mapped through the online survey and also online consultation. The key issues for youth in North Macedonia regarding SRHR. Can you please go to the next slide? Okay. So the key issues that we mapped till now are lack of formal comprehensive sexuality education in schools, access to contraception in each statistical region on the country, decentralization of the institutions that are responsible of providing SRHR services, and discrimination towards marginalized groups. Now I can explain what we meant to marginalized groups. There are LGBT plus community, Roma community, and also people with disability. Other issue is lack of SRHR youth-friendly services. So these key issues, young people and also young youth lead organization mapped through online service and also on the online youth consultation. About the youth commitment that we have till now are what young people and youth lead organization are willing to do in the future regarding these issues. They are lobbying for SRHR in front of relevant institutions and ministries. Also, a community approach for design and implementation of projects that will prioritize some of the key relevant issues that were mentioned in the previous slide. Also, educate the general public and youth on SRHR and comprehensive sexuality education, and prioritizing some of the key issues into the institutional agendas. That is really important in order to have action plans and some of the laws that will be focusing on SRHR, and also advocating for equal access for SRHR in each region of the country. I mentioned a couple of times about each region of the country. That's why we have the online surveys to get the meaning and issues that each region is facing in our country, and to get more broad explanation of what are the issues in each region, and also to more people to have access to SRHR and to have ability to spread them through this kind of youth national consultation. So that will be all from YPR Macedonia. So I will tell that we have more concrete youth commitments to the till November. So thank you.
Thank you very much. Do I still share? No, I think it stopped. So thank you very much, Lina and all Macedonia team. Please do not forget to put words to Mentimeter. Just now, Anuki informed us that you can put 2 or 3 words even, if it's not exceeding 25 characters. So you can put longer than only 1 word. Now I'm moving to Sargesev to learn who is next.
Thank you, Dalar, and thank you, YPR Macedonia, for the fruitful presentation. We're moving on to Central Asia again, and we have Turkmenistan here. I hope Guncha can hear us.
Can you hear me?
Yes, we can. Perfect.
Yes. May I start?
Yes.
Hello to everyone from sunny Turkmenistan, but today I should contradict my words. It's very cold in Turkmenistan. And I want to start that every time when we receive the mess, like my name is Guncha, I'm focal point in charge of YPR Turkmenistan network. And every time when we receive messages about the ICPD and etc., there's written by our ICs and other websites, we can't leave some young people behind. And this motivates our team to take the responsibility and to make national consultations on good level. We have made already 3 national consultations, and 2 of them also was made by UNFPA country office. First one was in summer, and with decision makers, it was organized by UNFPA country office, and YPR volunteers also were presented there. Like the main topic was that from now on Turkmenistan will have free contraceptions, and we have our IMOR. It's a social media account. Social media in Turkmenistan, it's very popular and it's a strong tool to deliver the message. And the website Yaşlık, which is also sometimes ruling by YPR Turkmenistan volunteers. In 8th of August, also in summer, we have organized the and roundtable, and after that the national consultation. And it was for the first time when young people organized it by themselves. We, White Peer Turkmenistan volunteers, went to the youth organization, to an FPA country office. We discussed that it's necessary, made presentation about White Peer and ICPD, and they believed us, trusted, and we made this consultation about the peer-to-peer method at universities. And the decision makers from Majlis, they promised that they might somehow include it to the national plan of our country. And after that, on 23rd of August, we also made a consultation by White Peer Turkmenistan volunteers with other NGOs, with disabled people, with other youth organizations and youth communities. And with that, we discussed the reproductive health and access. And we organized in September in regions. And actually, White Peer Turkmenistan volunteers asked to tell that everyone should need to have a choice. And in Ashgabat and in some big regions, young people are aware about SDG goals, about ICPD, but in far regions, in villages, there are not many people who know about it. And maybe they will be, as idea, they thought maybe there will be a bus, because we have a lot of volunteers who will do it without any money because they have just a desire, and they will make sessions about that and national consultations and aware all of young people of Turkmenistan, not only in big cities or to people who already know this. And also other solution was to involve psychologists at schools. We have some lessons, but to have psychologists, so young people, students will be able freely to interact with this person, and it will be anonymously. And another main idea, to have more youth centers in Turkmenistan, like we have it in Ashgabat, in Mari, and also to have it in other regions. This is the main ideas from people who were participating in youth consultations. And I hope that I was lucid and didn't exaggerate and was realistic. Like youth centers, psychologists at schools, and to inform more young people in villages. Thank you. Right here, cap with me.
That was amazing, Guncha. Thank you so much for the amazing presentation. A quick reminder for the Mentimeter, please put your words so that we can summarize the word cloud afterwards. And I'm passing the floor to Dalar to announce the next presenter.
I'm glad to announce another Balkan country. Albania is going to be next. So is there anyone from Albania?
Yeah. Sorry, just a second.
Is that right?
I'm here. Hello, everybody.
Yeah.
Yeah. I will share my presentation with you on PowerPoint. As you know, Albania finished the youth consultation during September, based on some Skype meetings and online consultation with DAGAR, other partners, and UNFPA country office. So we will share what our findings on the process of youth consultation. Sorry. Okay. Is shared with you the presentation? Can you see the presentation?
Yes, we can.
Okay, thank you. So, our youth consultation was during the Human Rights Academy supported by UNFPA country office for the 5th year or 4 years now. In the on 26th September, we were 28 young people from different schools and faculties of Albania cities like Tirana, Resheni, Korça, Vlora, Prizren, Gjirokastra, Përmet, Fier, and Ballakastra. We were 13 male and 15 female. Two of them were part of from LGBT community, and one of them was part of Roma community, and 8 of them were from rural area. We tried to have inclusive young people from different backgrounds, different marginalized groups in Albania, and from different cities. We were some youth organizations that were part of this youth consultation, like YPIR, Albanian Center for Population Development, Youth Voice Network of Organization, that is the only one networks that bring together youth organizations that work on sexual and reproductive health and rights in Albania, where YPIR is part of it, and LGBT Alliance in Albania. YPIR lead the process based on the support by UNFPA regional office and UNFPA country office. The other things that I want to mention here is that this week in Tirana, we have a regional workshop on sexuality education that will serve us for other feedback on behalf of ICPD conference in Kenya. And a lot of young people from YPIR, Youth Voice Network, and other youth organizations in Albania will take part on this event. How was the process? UNFPA, especially thank you to Douglas and UNFPA country office, during online meeting and face-to-face meeting, guide us on the process, introduce and share example on best practice, assist UNFPA country office, assisted us during the youth consultation. We used the guideline prepared by UNFPA that was shared previously with us. The young people who participated was random, but they were selected based on an open call on internet by YPIR and Albanian Human Rights Group and Albanian Center for Population Development. We shared with them an agenda in order that they to be familiar with the process. Agenda included introduction about YPIR and the event, ICPD conference in 1994 and 2019, and ICPD post agenda based on the guideline. Firstly, we introduced for them some information about sexual and reproductive health and rights, the main concerns for young people in Albania. Young people discussed about their past, about what I mean with the past is about the whole the whole events in the past for improving sexual and reproductive health and rights in Albania for young people. And during this discussion, we focused our discussion on ICPD agenda. The most constant topics were identified by young people, and we discussed with them for 20 minutes. Young people, during this time, young people voted the most relevant topics in their life, which should be addressed on investment in the future. We organized video and photo shooting on behalf of the campaign I Commit and I March For. And this video and the detailed report will share with UNFPA country office and with the Douglas later. As you can see in the photo, this was the most exciting moment for participants because is their future in their hand. They were well engaged in this process and share their concern with us. Which are the most voted topics and discussed by young people? We have listed them. Most voted people voted for non-formal education on comprehensive sexuality education, especially for out-of-school young people. Access to modern contraceptives, quality care, especially for healthcare services for young people, youth employment, youth migration, youth peace and security. Is not right here because the technical problem that we have in the beginning of the online meeting on this regional consultation. Youth peace and security and civic engagement were the most voted by young people during the youth consultation. They have proposed some solution for these issues. For example, regional youth exchange on topics related to ICPD, sexual and reproductive health and rights, youth peace and security between organizations that works in this kind of field. this youth exchange, we focused on regional youth exchange, not in other regional and sub-regional youth exchange. Peer educators and youth workers should be well prepared and certified on these topics. More investment and allies by government and other non-traditional donors like private sectors. In this moment that we're speaking, YPeer, as part of Youth Voice Network, have put in place some collaboration with private sector like pharmacy company, establishment and strengthen regional movement on sexual and reproductive health and rights through YPeer network, updating the guidelines and standards for YPeer education, climate change and climate change by youth organizations.
Sorry to interrupt. Can you give the last sentences just to make, thank you.
A regional platform where young people and youth NGO can interact with each other on these topics that we mentioned before, and some commitment by participants and especially by youth NGO that participated. Together with Youth Voice Network and other partners, we commit to engage more young people, especially men and boys, collaboration with private sectors, collaboration with regional and sub-regional partners like Regional Youth Cooperation Office, and to work more on out-of-school comprehensive sexuality education. Thank you.
Thank you very much, Andy. It's very inspiring to hear all of those. And again, a quick reminder for the Mentimeter. So I got a few questions. So let me explain the Mentimeter once more. There are 10 columns that we can write one or two or three words up to 25 characters, and we are using one column for one presentation. So now for Andy's presentation, for example, we all are going to put one or two words up to 25 characters. So we are moving to the last presentation, I guess. Sorry, guess.
Thank you, Andy and Dalar. Yes, we are already coming close to the last registered presentation, although we will have the opportunity for countries who are present here that haven't done or haven't had the opportunity to be registered. We'll have opportunity as well upon, we will ask after the last presentation. And for the last presentation, we're going to Central Asia again to finish where we started, and it's Tajikistan. I hope that the presenter of Tajikistan is online and on board.
Yeah, can you hear me?
Yes.
Oh, great. So greetings to everyone from Tajikistan. My name is Abdusalam Rabikov. I'm working in NGO as a program manager, and also I'm currently focal point in charge in YPeer Tajikistan. I will try to be as short as I can and share information about our national consultation. The situation in Tajikistan is similar to Kyrgyzstan. Population in Tajikistan are more than 9 million and average age is 22, which tells us that we also have young population in CA. And unfortunately, we didn't dedicate a special meeting to national consultation, but we did have two main integrated events with UNFPA country office on youth consultation. One of them was devoted to the 50th anniversary of UNFPA and 25th anniversary of ICPD. In this event, we invited all main actors working on ICPD, as well as NGOs and governmental structures. Second, integrated meetings on national consultation were conducted in regional level. In collaboration with Ministry of Education and Science in Tajikistan, we invited neighbor consultants from Kyrgyzstan, Kazakhstan, Ukraine, Russia, and Uzbekistan. The regional meeting mainly devoted to promoting healthy lifestyles and prevention of HIV/AIDS among adolescents and youth. The result of the meeting was a commitment with recommendation for comprehensive coverage of ICPD. And in addition, national network by peer in Tajikistan empowering potential of adolescent and youth by conducting TOT info sessions and advocacy campaigns to achieve main outputs of ICPD. For instance, in 2018, within support of UNFPA country office, we prepared around 80 certificated peer trainers to promote healthy lifestyles, sexual reproductive health and rights, HIV/AIDS, gender inequality, among their peers, as well as social media campaigns in social media, in particular in Facebook. We do social media campaign in iMarch 4. And finally, I just would like to add that we are planning to have follow-up meeting based on commitment with recommendation, where we develop a roadmap. And I hope that after this virtual regional meeting, we would have national consultation, because we were planning it, but due to some technical reasons, we just don't have physical time to conduct it. So this is the short and brief information about Tajikistan.
Thank you very much for your presentation. Everything is well noted. I want to remind for the last presentation to put the words in the Mentimeter and to finish the 9 presentations, and then we will be able to see if we have other presentations. For that reason, I want to give the floor to my colleague Dalar so that she can open the round for discussion.
Thank you very much, everyone who presented. And now we are looking for the presentations that were not in our list. If there is any other person from any of the countries who were not represented in the presentations, is there anyone? Can you write to the chat box if you want to present something?
Hello, can you hear us? Hello?
Yeah.
Yes.
Yes, you hear us. Hi from Ukraine. So introduce.
Hello, so we have a presentation. If we can start, or you want to just to check with other countries? So,
You can go first, and then if there is any other country, you can write to the chat box, and after Ukraine is finished, then we can move to another country.
Okay, thank you so much. Good afternoon, dear colleagues, and Ukrainian country office is glad to host the youth delegation here. We have 4 delegates here in Ukraine. Now here you see Darina, she is gender activist. Here is Taras, he's working on youth empowerment, and we also have here stars Yana and Danya. They are from Teenagers, who are well-known activists on reproductive health, particularly HIV and sexual education. So now I give the floor to Taras, who will have 1 minute for youth empowerment.
We cannot hear you. No. Am I saying arkaya yaklaştırmıyorsunuz? No, we cannot. No.
Hello?
Yes.
You hear
Yes,
us?
now we can.
Okay.
Sorry. Anyway, I hope you will hear me. Okay, so I'll be shorter than should be. The first challenge is the gap in access of young people to information, opportunities, and resources, especially for young people with vulnerable groups, like youth with disabilities, rural orphans, HIV+, drug users, ex-prisoners, and etc., and especially girls. Also, the issue is insufficient level of independence in decision-making of young people for their lives, and low motivation for development and self-reflection. And of course, the big market and education gap. So what the solutions we see here, the first is interventions, of course, and opportunities for vulnerable groups of young people. We have a lot of programs for girls, for example, like hackathons, like programs for mentorship for girls. Also, we see the solution like life skills education, engaging young people and young influencers like bloggers, top managers, to spread some life values and some skills. And also development of youth centers and NGOs for young people. And the last one for social and economics issues is solution is career guidance and business education partnerships for young people, including internships and mentorship for young people. And we can,
yes,
I can give a floor to Danny.
Take my words. Thank you, Taras. Yes, I'm gonna take my microphone, put the camera on me. So hello everyone, my name is Danny again. We had a small consultancy here with the team, so we had an opportunity to describe the main problems faced by young people in terms of lack of sexuality education. So we describe it in a very, very general manner, okay? So we have 5 of them, which are very about everything, okay? So the first one is intimate and gender-based violence, stigma and discrimination based on the low level of sexual culture and knowledge. As far as you can understand, we are the post-Soviet country, and of course there's no culture of sexual health, sexual awareness, and that causes a lot of problems in society, in all the groups actually, but I will be brief. So the second one is gap in education, insufficient level of knowledge and skills in the area of SRHR. I mean, that's quite obvious, okay? So the third one is low access to youth-friendly services related to SRHR, including condoms and prevention. So in Ukraine, we have lots of different services for young people, including the youth-friendly clinics, but unfortunately they are not working that equal like they could work. So now we are working on changing it, but it's a very important point if we want to have a sexual health of our population in the future. That's the point where they have an access to condoms, prevention, and services. Okay, so the first 3 problems were related to education generally, and the number 4 and number 5 are related to advocacy, policy, and so on. So the number 4 is low political commitment to sexual and reproductive health, particularly it's discriminatory laws and that's it, number 5. And that's it. Number 5, lack of data on STIs and weak management of official statistics in the group of young people. So we unfortunately do not have enough evidence to show on the STIs among young people. The only thing we can have is data on HIV epidemic among young people. So that was the problems, and briefly for 2 minutes, it's decisions. For the first 3 problems related to education, we have 1 decision, which covers lots of areas. So it sounds like developing a multi-sectoral model on comprehensive sexuality education services and care, which will work on the youth-centered approach and engage medical educational facilities, including school curriculum, parents, peers, and services, including online services.
And for political advocacy and statistical, we have suggestions like?
Yes, so for political increase, what we thought of is that for realizing all the political goals we need to implement sexuality education, first thing we need to do is to develop ourselves as an experts in policies and so on. So it sounds like increasing and developing the capacity of young advocates and supporting legislation and country roadmaps on implementing the comprehensive sexuality education. If we will have enough potential and capacity, we can push it for next 2 years. And the last, not the last, but the next point of this decision is to conduct a national level researches on STIs and researches on STIs, early pregnancies, sexual debut, and so on. So that's it. It's very in general and from our team. Thank you for your attention.
Thank you very much for the presentation. So I think Serbia will go next as they wrote it first. and then there is Georgia, and then Bosnia. So before starting with Serbia, let me remind that we have only 2 minutes per country. We know that the time is super limited, but otherwise the whole consultation it will be longer. So let's try to make it as short as possible and go with the Serbia.
Thank you. My name is Igor and I speak in front of Serbian team. We didn't have any national consultations, but we will hold one after Cairo conference. We have 3 recommendations based on 3 problems which we think are most relevant. First problem is about general education. We have problems with university students because they can't work and study. They can do it in theory, but our laws about that are very bad. So we want to make, we think we should make a better system which enables students to work and study. When we speak about general education, we must speak also about children who are living and working on streets and children migrants. We need a good system of engaging that children who are not in institutions, because if we speak about children which are migrants, if they are in migrant camps, they must go they have to go to primary schools. Otherwise, they're not obliged to do it. So we want good system to engage them in primary schools, to educate them on their rights. The second thing is it's gender equality and breaking gender stereotypes. We have a big problem about gender equality and about understanding what gender equality is. So we think that we need more education, especially for girls in rural areas. Because of not knowing what is gender equality, we have a lot of child marriages, which is very bad. And the third one is comprehensive sexual education. A number of people who are infected by HIV in last few years going up, and also number of abortion is quite big among young girls and women. When we speak about child marriages and sexual abuse of young girls, especially Roma, especially young girls from Roma population, we think that comprehensive sexual education should be one of the greatest concerns of Serbia and Ministry of Education, and that we should implement that in in everyday school practice. Thank you.
Thank you very much. So there was a question about Mentimeter. We have only 10 words option, so we were thinking to have 1 word for the whole part for the presentations coming additionally. But if you want to involve other words, you can write it to chat box, and then Petri said that they can also involve those additional words to Mentimeter word cloud later. Thank you for that, Petri. And then we are moving to Georgia, I guess. Now I'm reminding we have 2 minutes per country, and it's Esma from Georgia is going to talk about Georgia. Esma? Okay, I think she's not online, so we can move to Bosnia. If she comes back, then she can continue afterwards. Bosnia, are you here?
Yes, we are
Yes.
here. Hello. Hello to everybody. It's nice to hear and to see you. My name is Yasmina, and here I am with the colleagues from UNFPA, Bosnia, and some other young people that are supporting the consultation process here in the office. So basically, what we did here, we based our consultations on experiences, practices, and data coming from different fields, and most important, like thinking about in two ways. First one is thinking about young people as activists, and secondly, thinking about policy level. So what is actually existing and what are we missing in Bosnia and Herzegovina? In the end, what we came out with and in which direction we decided to go and what to work on in the later stages as well is next. So we were thinking about the questions like how do we see young people in our country, like what are their needs actually, who is asking about the needs of young people, are they visible enough, what is their level of participation, most importantly, what is their level of participation in local communities, and as well we wanted to offer some answers, like how do we satisfy young people needs. What are we building and what are we bringing and offering to them? Something that we consider as most important, even speaking about the topics that are in focus during the Cairo and Nairobi, but in general, when it comes to young people's appearance in society, is how we can create and maintain long-term support that young people need from us. If we speak about if we speak about youth, young leaders, what those young leaders need to become ones. So what are the preconditions? And that is something that we want to focus on preconditions, because we believe that even youth work can support and provide, first of all, peace building, and secondly, make young people to take even more responsibility, let's say. So basically, this is something that we were discussing, and if my colleagues here have something to add, I would just kindly ask them to add. But they are like waving and saying like, that's it. So thank you very much.
Okay, thank you very much. Now we are going back to Georgia, if Esma is here and still wants to present.
Yes, I'm here. I hope you can hear me well, because I had trouble unmuting myself. Can you hear me?
Yes, we can. Yes,
okay,
we can hear you clearly. We have 2 minutes, just to remind again.
Right. Good evening, everyone. So I'm Esma from Georgia. I'm the UN Youth Delegate of Georgia currently, have just returned from the UN General Assembly. Is Ms. Jayatma still here with us?
I am, yes, I'm listening.
I would like to thank you for being here and joining us, and I would like to tell you that all the youth delegates at the UNGA said hi. We had a productive photo with the Secretary General. However, of course, we all would wish to have more discussions and you know, to have at least some time as youth delegates, either with you or, of course, also with Secretary General in future, if possible. And also, on behalf of my previous youth delegates of Georgia, I would like to extend the invitation to Georgia, and we can communicate about that maybe more. With regards, I would like to talk about people with disabilities and young people with disabilities. because this is the group I'm most familiar with, and I also believe is less talked about. Some of the young persons here have mentioned their needs. I would like to add that there are a lot of young people with intellectual disabilities who also need information in accessible format, such as easy to read format for them. So we need to develop these formats in different languages. There is also a need for sign language accessible information on reproductive health and sexual education. We have a very great website, All About You. However, I have a feeling that not so many young people in Georgia are unfortunately aware of it. Therefore, we can continue working on making it more popular and visible everywhere. People can write anonymous questions there, and there's also a closed Facebook group where women and girls can discuss health-related issues. But returning back to people with disabilities and young people with disabilities, of course, there's a lot of stigma around their reproductive health and rights. Many of them, and many times they're considered as asexual beings who are not interested and should not be interested in relationships. Of course, in all kind of institutions such as psychiatric hospitals and disabled persons like housing, a lot of times people are prevented from even having meeting with the persons of the opposite sex. But also we never talk about those young people who are locked up in their homes due to the lack of the services, lack of personal assistance service, lack of sign language interpreters, lack of sighted guides, lack of mobility and orientation trainers who could teach young people skills that they need to get around and meet other people and be involved everywhere outside of their house, and not be always at the disposal of their families and under the control of their families, who can determine at this point where disabled youngsters can go, with whom they can contact, with whom they cannot. It's also important to have gender-based violence shelters for the victims, more than we have now. We have 2 state-sponsored ones in the country currently, which of course are not enough, and the services are not comprehensive. They don't extend beyond 6 months period, after which women has to live somewhere. But for people with
Sorry for
disabilities,
interrupting, but can you try to finalize?
So just more awareness on the disability-related issues and reproductive health, more accessible information, and as I said, more services such as gender-based violence shelters or the housing, etc. Yes. Thank you.
Thank you very much to everyone who presented and not presented but just joined and listened. So we are before moving to the discussion part, I want to remind the last time the Mentimeter and to write another word for the other amazing presentations coming from Ukraine, Serbia, Georgia, and Bosnia. Thank you. And when you write the last word, you can submit your answers to the system. And now we are going to move to discussion part, but before that we are excited to hear the reflections coming from Jayatma and Alana. So I want to start with Jayatma. And Jayatma, what do you think, what is your reaction to all the presentations from the region? And what is your commitment for the ICA youth? What do you want to say to all of us?
Well, thank you very much. And first of all, I have to say that congratulations. And I'm really impressed by seeing all the very important and hard work that has gone into the country consultations, and particularly really acknowledge and admire the work that the youth organizations, particularly YPA, has been doing in the region and beyond. I also want to quickly say thank you to the youth delegate of Georgia, and unfortunately I was not in New York when the youth delegates were here and didn't have the meeting to meet, but hopefully we can continue the conversations and continue to engage through these different thematic tracks. When the presentations were going on, I was taking a lot of notes and sort of making notes myself, and I've been comparing strategically sort of how, under two main questions, how we approach and how we sort of march towards Nairobi in the coming weeks, but also beyond Nairobi, beyond November, how do we strategize taking this forward, and particularly how the Sustainable Development Goals, Agenda 2030, and the UN Youth Strategy, Youth 2030, can drive the ICPD program of action and contribute to the unfinished business of ICPD. And I think the answer is that we cannot achieve the Agenda 2030 for sustainable development without achieving the goals set out in the visionary ICPD program of action, which was groundbreaking at the time with its human-centered approach to development, putting young people's human rights at the front and center. And in terms of addressing the ICPD's unfinished business, and as it relates to youth, and as was mentioned by many of you today this morning, despite obvious progress, a lot still remains to be done. Especially at the regional level, you've discussed a lot of these issues, and I've also been thinking about how similar some of these issues are to the concerns and priorities that young people from other regions and other parts of the world has shared with me. For an example, our world today is confronted by a huge number of young women in developing countries, particularly, who are married as children, usually little or no say in over the matter, and often married to older men, and they make up a large proportion of the 15 million adolescent girls who give birth every year, who basically have children while being the children themselves. And I don't need to remind you that in many countries, young people continue to face barriers in accessing sexual and reproductive health services, information and education, leading not only to high levels of teenage and unwanted pregnancies, but continued high rates of STIs, including HIV. And I was really interested when the point of civic and political engagement came up. Young people are also often confronted with social, legal, and other barriers that limit their participation. Either it is about making decisions about their own bodies, about their own families, but also at a national, regional, and a global level. Many young people also, and I think it came up particularly from the presentation in Tajikistan, young people who are in areas of fragile contexts affected by security and stability, how then that also affects their agency and their empowerment and their ability to make decisions about their lives. So thinking about this, I think it's quite important to keep in mind the multi-sectoral response to cater to adolescents and young people, and sort of think around how we bring other sectors on board on the quest to fulfill the unfinished business of ICPD. And I think education as a prerequisite to demand our rights is what I've heard from a lot of you around the table, sort of advocacy, education, the educational youth movements, comprehensive Shakrali education, and the importance of educating and mobilizing young people around ICPD to ensure ownership, but also to carry the agenda forward. And to do so, and again, this came from the presentation in Kazakhstan, that intergenerational conversation is key. And this is something that I'm really struggling sometimes, particularly very recently at the climate change conversations. I feel like governments and policymakers are in a very extreme side, and then young people sometimes tend to be on the other extreme side, and we sometimes don't have positive, constructive, intergenerational conversations. And I really hope that Nairobi will be that platform, that in Nairobi we can actually bring people who not only think the same way we do, but also people from different opinions and different backgrounds, and sort of break ourselves away from the echo chambers and come together to have these kind of conversations. And particularly, I'm looking at ICPD, and ICPD being in 1994, sort of ahead of its time in terms of recognizing young people's rights. ICPD was the first program of action or international framework that actually recognized young people's right to political processes, to participate, to engagement in planning, implementation, and then monitoring and review of framework. So it is very important to maintain that, and we know that in a politically polarizing environment that it could be difficult, and that is why I'm very happy to be here and to join other regional conversations to sort of build that solidarity network among young organizations around the world, so that we can jointly push for progress and not stay silent when this agenda is under attack, or when our rights as young people to make decisions and choices about our lives are under attack. So my commitment is that I will continue to advocate. I will continue to advocate for the rights of young people, their access to information, education, and I will echo your voices and your priorities and your concerns that are coming through these different consultations, both online and offline. And my second commitment is that I will continue to work with governments, because young people's commitment and mobilization and youth-led education and peer education is not enough, because they need to have safe and conducive environments to do that advocacy, to do that education. So wearing my hat as a UN official, I will also work with UNFPA, the regional directors, but also with the governments in the regions and in the UN, to make sure that they create that safe and conducive environment for young people to thrive. Thank you.
Thank you very much, Jayatma. Now we are moving to Alana to hear her reflections.
Okay, thank you so much, Daler. Good afternoon, everyone. Good morning, Jaya. I think you're in New York. I'm not sure, but
hi, Alana. Yes, I'm in New York.
Okay.
Earlier, sorry. Hello.
Hi. Greetings from Belgrade, where I have the privilege of being this week participating in the Interparliamentarian Union Assembly. Together with a lot of other UN and people from all over the world, which is very exciting, but also a wonderful opportunity to be here in Serbia and to be in this room with several of our youth advocates, champions, leaders in the field of sexual and reproductive health. Let me just thank you quickly, Dalar, for coordinating this great virtual conversation. We really appreciate it. To Sargis for facilitating the country office participation, or the country participation, and Anuka for the regional presentation. That was great. And greetings to all of you. Wonderful that we really have such a diverse representation here today from Armenia, Bosnia and Herzegovina, Georgia, Kazakhstan, Kyrgyzstan, Moldova, North Macedonia, Serbia, Turkey, Turkmenistan, Tajikistan, and Ukraine. I hope I didn't forget anyone. But it was great that we heard from all of you, and thank you for the wonderful presentations, as well as the summaries of some of the national consultations which you've had, which have clearly resulted in some great commitments. Above all, I guess for me, it's just so wonderful to see this youth leadership around the ICPD 25 and the road to Nairobi. You know, whether you're participating in Nairobi itself or in an event on the way to Nairobi, which several of the young people in this room, some will be participating in a CSE meeting in Albania next week. We have our friend here who is going to Cairo to go to the big meeting in Cairo tomorrow. So there's a lot of people participating either in Nairobi or in events leading up to Nairobi. Whatever it is, your voice is absolutely critical. So we're just really pleased that you know, young people are so vocal and visible on this issue. I also wanted to thank the young people from YPeer, the European Youth Parliament, Choice, UACT, and YSAFE, who have also taken on leadership roles in this area.
Ну, создать имитацию, я понял, хорошо.
Hi, хорошо.
Создать имитацию работы, получается. Ага, хорошо.
This happened to me before. Yeah. Can you hear me over the other voices? Okay, so the other thing I wanted to really appreciate is all of the young people who have joined the conversation today. I realize, you know, how much time you're dedicating to this, that often this is really, this is a volunteer job you're doing. It's a mission for you. And, you know, you're fitting in these commitments between work or education. So we really, really appreciate that. So reflecting on the actual presentations that we've just heard, I think like Jaya, I've been taking notes and I'm curious to see the word cloud now because I wrote down my own sort of words that kept popping out to see if they would match the word cloud. But issues like non-discrimination, HIV, SRH of people with disability, LGBTI rights, sexual health, intergenerational dialogue, importance of local level action, that came out a couple of times. Youth unemployment, including the gap between market and employment, the issue of young people who are not in employment, education, or training, NEET, as we call it, migration, teenage pregnancy, GBV, discriminatory laws, data, and evidence. Unsafe abortion, child marriage, climate change, clearly way more than 10, and comprehensive sexuality education. And despite the gains that we've made since Cairo in the last 25 years, there are just way too many issues and the rights of young people have yet to be realized. For UNFPA, young people are at the center of change and the aspiration of ICPD 25 and sustainable development. We are working with all of you so that young people can realize their rights and make informed choices about their own bodies, their own lives, and the world that they live in as a matter of justice and, of course, as a driver of sustainable development. Someone mentioned the issue of evidence and data and not having enough, and I think that one of my reflections is, is the issue of evidence versus action. Does evidence really lead to action in our countries? I'm not sure if it always does. So what do we need to do differently in the way that we are strategizing together? The ICPD 25 process and the summit, I think I agree with Jayatma. It's a great opportunity for young people to influence the policy priorities and put young people's SRHR high on the agenda, keep it there. Shape commitments from policymakers and hold them accountable. So, we can do this even in the next few weeks before, I think there's now 27 days left to go to Nairobi. Form alliances with young people and other youth stakeholders, and then learn from each other about the great initiatives that are being undertaken by and for young people. Thank you, Jayatma, for your commitments to bring the voice of ICA countries into all of your conversations, including those around Nairobi. My own commitment, I was actually a younger person. I don't know if I could call myself a young person. I was under 30, so when Cairo took place, I was not there. I certainly wanted to be there. So my commitment would be to make sure that as many young people from our region are in Nairobi and are able to participate at least on the road to Nairobi. And this virtual conversation is part of that, but many of you will be there. I would like to continue supporting young people's leadership in this region to realize sexual and reproductive health and rights. And then supporting the regional platform where young people, NGOs, UN agencies can interact. This is something that came out as a recommendation. I think that's something that we really need to take on more strongly. The other thing that we're doing, and that I would like to commit to even more, is to bring the youth agenda even more strongly into the core work of UNFPA in all areas. So next week, for example, in Sarajevo, we're organizing a high-level meeting on population dynamics and sustainable development to look at how demographic changes in this region, in the Western Balkans, is impacting on sustainable development. I would say 50% of it is focusing on young people and the need to invest in young people. We will have a lot of young people there, but also those who are working on youth policy. So this is something that we are very committed to. I guess I would just I'll end by saying thank you again. I'm happy to answer any questions. And one request to all of you, I don't know if all of you have already uploaded your iMarch4 video, but if you haven't, it would be wonderful to see all of you mobilize so that together we can sort of, push forward the momentum of the young people in the region marching towards Nairobi. Thank you so much. Dala, over to you.
Thank you very much, Alana. It's very nice to hear your commitments as well. And it's very inspiring for us, and it's very motivating for us to continue working on the field. So now we are, before moving to discussion, I guess the word cloud is ready. And Julie, maybe you can, Petri, can contribute here.
Yes, thank you very much, Dalar. As you all already saw, the word cloud is ready, thanks to all of you and your contributions. As you see, there are a lot of words there summarizing the key points in the presentations, the challenges that young people face in our region, and also some of the solutions proposed. So the most repeated keywords are gender-based violence, LGBT, creative solutions, CSE, and education as a whole, gender, youth and young people, people with disabilities, youth centers, and commitments. Of course, there are many more words reflected there, so for sure we can keep this word cloud as a reference to all the presentations and the consultation that happened today and the national consultations. So thank you all, and we will share with this word cloud also widely with partners.
Thank you very much, Julie, for that quick information and presentation about the word cloud. And now we are moving to discussion. Since we are over time already, we have limited time, but if there is any questions, it can be a question to Alana, Jayatma, or any of the presentations, or just a few comments.
Yes, hello. It's Ukraine here. We have not really the question, but the proposal to all the participants. What we thought of within our small consultation here with the team that, lots of countries in ICA region have in many ways, in many moments, common, yes, and similar specifics, problematics and issues. And in many, of course, in some points and different, but in general, we are kind of quite similar in our specifics, as I already said. So we have a proposition. What if within, me personally, if you can see me, and Daria, we will be in Cairo tomorrow. And what we propose is to form kind of small coalition of youth representatives from countries of ICA for us to have like a shared view and maybe common steps which we can in further propose on the big meeting in Nairobi to the country leaders and so on. We can all connect there, make our small kind of meeting and discuss what we can do as a region. What do you think of it? Thank you.
Thank you very much. I think it's a very good idea, and there are many people going to Cairo. My voice is, yeah, okay. So I think, I don't know if others are interested, but if you're interested, can you write it to chat box, because otherwise there will be so much noise. And I know that Sargis is going to be in Cairo tomorrow as well.
And Julie, yeah.
Yeah, both of us will
and
be there.
Julie, yeah. We couldn't hear the last part, but maybe you can also help to coordinate for that.
Hey, Dalar, hold on.
Well, just to respond to Ukraine from Serbia, Victor, I'm going to Cairo with one of my colleagues tomorrow. She's not here, but we can meet in Cairo. Yes, tomorrow or the day after tomorrow, you know, in the morning. I think that's a good idea.
Can you write your email address to the chat box, or I don't know, if you're not comfortable sharing, you can send it to me directly so we can coordinate easily afterwards. Perfect. Great idea.
Yeah, sure.
So is there anyone else?
I would like to participate as well. I'm not going neither to Cairo nor to Nairobi, so my proposition is if we could share our email addresses, and so that we could, let's say, contribute to the draft of, I don't know, an outcome document or whatever will there be, and so that we could share it amongst each other.
Yeah, sure.
Another proposition or question, how can we share our iMarch4 videos, I mean, rather than and except for then just posting them on our personal accounts?
Hi, Esma. That's a great question. This is Yasmin from UNFPA Icaro, and I work in the communications department. Normally, we would ask you to post your Why I March videos on your social media pages and tag our account, which is generally Icaro UNFPA. But if you don't feel comfortable doing that, you can also send it to us via email, and then we can compile a video of all your testimonies, which would also be very exciting. So whatever you prefer, and you can get in touch with me via email as well. I'll drop my email in the chat box so anyone can send me questions. Thank you so much.
Okay, thank you.
I saw that Marta wants to make some suggestions or a suggestion. Go ahead, Marta.
Yes, thank you. Thank you very much, and very excited to hear all this amazing work. And it's really motivating being busy in the secretariat with the bureaucracy and spreadsheets, so that it really brings an energy and meaning for the summit. Thank you. I have two suggestions. One is related with those who are coming to Nairobi, young people, so that we seek their support to bring all these ideas coming from the national consultations and voice them in the summit, so that we can continue channeling this information further as the summit will be evolving, so they can land in different conversations, in different opportunities which the summit will provide. And of course, we know a lot of amazing work is being done and will be done by very many volunteers who will not be able, regretfully, to be in Nairobi due to the limit of the summit and the financial constraints we are facing to accommodate everyone. So we wanted to suggest, as the summit is running, to have a get-together opportunity in the country offices where you can maybe through the streamline be part of the summit, but also you can continue your own conversation on the way forward, discussing more specifically what can be done at national level. By in the next year, UNFPA offices are preparing their country programs, so a lot of these suggestions which you made and a lot of the commitments you voiced can easily land in very concrete plans in our UNFPA work for the future in your countries. Thank you.
Thank you very much, Marta. So I think it's, yeah, that's a great idea. And by the way, people keep writing their contacts. It's very useful. And we are going to, yeah, great. Also, we are going to collect all this contacts and get in touch with all of you. Guncha, you can go ahead.
Thank you, Dalar. I just wanted to tell, like, it's very amazing that there will be work in Cairo and in Nairobi. And my suggestion is, what about the future? I'm convinced that everything will be done in a good manner and way in Cairo and Nairobi. But I mean, to continue to have such kind of regional updates, consultations in future, also after the Nairobi. I mean, not to stop the work only before the Nairobi and during the Nairobi summit. After the Nairobi summit, to have consultations and to update, do national networks, not networks, youth, do something. Like, it will be check and balance. Thanks.
Thank you very much, Guncha. The follow-up part is also very important, as you mentioned. After Nairobi, everything starts again with our commitments as well. So it's very important to plan something after Nairobi as well. And thank you. And Kyrgyzstan, there is a question from Uluk, I guess.
So hello everyone, once more time. Thank you for sharing this amazing work, what you're done, all of you. I have a question about agenda of ICPT summit. Who will be represent from youth and who will be make a statement in summit among governments, among NGOs and other people from the youth of EEC region and maybe global from the part of youth. Who should answer that question?
Marta, do you want to answer the question?
Yeah.
Or I can answer.
Sorry, can you summarize it? I couldn't get it.
Can you explain which young people and which governments from the ICA region will be attending Nairobi? I think in this case, particularly Kyrgyzstan is interested in knowing which organizations from Kyrgyzstan maybe. But what I would sorry, say it again.
Yeah, I'm so sorry for explaining not really good way. I'm asking about who will be, I mean, like a speaker to make a statement from the young people.
Okay, I got the question. I can address it. Yes. So as of Friday, the Nairobi Summit website has opened the commitments page. So we invite you after this call, so partners and governments can start posting their commitments with regard to the Nairobi Summit and the outcome of your national consultations. There is one requirement for you to be able to upload the commitment is that the person who is uploading needs to be registered, which will from your side mean that you have to, if you are not you specifically involved in the summit coming, you have to link up with the young people who are coming from your country and are registered for the summit. There are also guidelines on the website how to frame the commitment, which actually provides understanding in the future accountability process. So it has to be time bound. It will require additional effort from your side. Some of the suggestions you made might need to be addressed faster. Others might take a longer time, so you can give certain time horizon to the commitment. What will be also good when you're framing the final commitment from your side, also to think about being measurable, to be so-called smart, so that we know what exactly we want to achieve, you know what exactly wants to be delivered. And the last is also important, and I heard several times you were asking certain institutions, organizations, or your own organization to act upon this commitment. So you have to also indicate who is in the executive power to make this commitment a reality. So please visit the website, familiarize with the guidelines. If any further guidance are needed, we stand ready to support you to finalize your commitment. And then feel free to post it on the website. After it's posted on the website, this will give you chances to voice it, because behind the scene, as the commitments are received, there will be also organized a speaking slot in the summit to be voiced during the session on the commitments. And this is happening in the order the commitments are coming. So you might end up speaking after the Minister of Denmark on development. So there will be, for the first time, no clustering, like first the ministers and then young people, which very often is the case, but rather based on the timing and the sequence order they have been submitted. So we encourage you to submit your commitment before Nairobi Summit to allow yourself to have a speaking slot to voice it during the summit. Thank you.
Thank you.
Thank you very much, Marta, for clarifying the question. And Jayatma said there is a youth working group for the summit that UNFPA Youth Team at HQ is coordinating. Will be great to give these inputs and suggestions to them as well. I think they're designing the session, speakers, etc. So definitely we can also pass them, we will pass the results of the consultation to them as well. And she said, unfortunately, I have to leave for another meeting. Thank you very much for having me. All the best, and see most of you in Nairobi soon. So she also left an email address. So she said you can always get in touch through that email account. You can check it. And yeah, I am gathering all the email accounts shared in the chat box. And if there is any other questions, we can move to that. If not, we are moving to closure. I think we're already late for 15 minutes. I see that Marta is showing the word cloud. So it's like the result of what happened here today in 2 hours. It was very exciting to have everyone here and to see the results of very hard work of months. And thank you very much for being here, for being committed to continue working to achieve the goals of ICPD and to move forward together. I hope to see all of you in online in Cairo, in Nairobi. I don't know, not all of us will be in Cairo or Nairobi, but we will always be here to support each other, to be a part of this process. So maybe we can make another applause to everyone, like all together. We will be keep in touch. So if there is anything to add from anyone, go ahead. Otherwise, we will see each other online or face-to-face somewhere in the world, hopefully. Bye.
Thank you very much. Bye.
Thank you, everyone. Bye.